The U.S. Surgeon General is declaring gun violence a public health crisis.
For the first time in the history of our office, I am issuing a Surgeon General's advisory on firearm violence. It outlines the urgent threat firearm violence poses to the health and well-being of our country.
Dr. Vivek Murthy made the announcement Tuesday as the U.S. Department of Health and Human Services released new staggering stats on gun violence. According to the report, gun violence leads to cascading harm across all of society, not only those who are physically affected by gun violence, but also those who witness it, lose a loved one from it, or are exposed to it in their communities, including schools. Gun violence creates collective trauma and fear for communities. Since 2020, gun-related injury has been the #1 cause of death for American kids and adolescents between the ages of 1 and 19. The U.S. also saw more than 48,000 firearm-related deaths in 2022, which is 8,000 more than 2019 and 16,000 more than 2010. And even though we see mass shootings in the news every year, mass shooting deaths account for only 1% of all firearm-related deaths. However, mass shootings are becoming more frequent. Between 2020 and 2023, the U.S. experienced more than 600 mass shooting incidents each year, compared to an average of less than 400 per year between 2015 and 2018.
Our children should not have to live in fear that they are going to get shot if they go to school. None of us should have to worry that going to the mall or a concert or a house of worship means putting our lives at risk, or that we'll get a call that a loved one in a moment of crisis has taken their own life with a firearm.
51% of teens say they worry about a shooting happening at their school or close to home, and 79% of adults experience stress from the possibility of a mass shooting, while 33% say fear prevents them from going to certain places. The Surgeon General says factors contributing to gun violence are complex, but that if we all get on board, we can turn the tide on gun violence in our country. Dr. Murthy recommends communities create violence prevention programs and risk reduction strategies, improve mental health services for those affected by gun violence, and expand research funding for prevention strategies.
Firearm violence is a public health crisis. Our failure to address it is a moral crisis. To protect the health and well-being of Americans, especially our children, we must now act.
For Straight Arrow News, I'm Lauren Taylor. We have a link to the Surgeon General's full report on our website, san.com.